Serious people that do autopsies. What's the weirdest thing that you have found that didn't have anything to do with the person's death? I worked as a pathology assistant. My boss once found a 6-inch builder's nail in a chap's thigh. He died on site after an accident, but the nail was all healed over. Even where it had nicked the bone, so it must have been there a few years. A paramedic buddy showed me pictures of an accident where the guy was carrying a nail gun up a ladder to a roof and accidentally drove a nail through his pocket. The iPhone in the pocket and into his femur. The hospital did imaging to ensure it wasn't going to blow an artery and then just yanked it out. I'm not sure my face will ever be able to move from the expression of cringe this prompted. It gets even better when you realize just how fucking massive a 6-inch nail is. UK gang member's mother died of a heart attack during a home invasion, aggravated burglary, 87 years old. Gang had burst in looking for drugs and money. No signs of assault, but the circumstances required a full examination to be sure nothing suspicious had occurred. During the post-mortem, 2 ounces of smack found in her anus. Back in the 90s, I worked for the company that was contracted to move bodies for the coroner. We picked up the body of a lady who had worked as a tailor in her youth. When they did the post-mortem, there were several dressmaking pins and needles under her skin, mainly in her legs. There was also a pin lodged in her lung. Coroner thought she must have inhaled it. She'd suffered a pulmonary embolism back in the 60s which had forced her to retire. Maybe the pin was the cause of it. How she hadn't felt the pins, or that none of them had been picked up on X-rays or scans she'd had in later life, I don't know. Cause of death was a stroke. I was once in a mental health facility for only a short amount of time. And I met a woman whose daughter passed away from a drug overdose and had been upset at her for selling her grandmother's necklace for what she thought was drugs. But when the autopsy came back, it was found in her stomach. Apparently she was swallowing the same necklace for years, and I can't imagine why someone would do that. Rolls of dollar bills inside the vaginal cavity. Removed it and let her property dry and then returned to the family with the rest of her belongings. So wash your hands after handling money. Edit, maybe 50 bills. But can't remember if they were singles or large bills. Cause of death was an overdose. I think, but not sure. I wouldn't necessarily say this is a weird thing, but once during an autopsy, I had just put the body onto the table, on their stomach, when the person had explosive poop. Luckily, the doc who was standing right beside them moved in time, or else they would have been shot with poop. We didn't think it was ever going to stop. I was volunteering at the coroner's office and the doc pulled a very large, intact avocado pit out of a man's stomach. We all kind of looked at it and went, huh. Cause of death was a heart attack. While completing the post-autopsy repair for a gentleman, I found a plastic ladle tucked under the ribs. It was probably left by some poor autopsy technician who got yelled at for losing the good ladle. I offered to send it back to the coroner, but they never returned my calls. What is the purpose of a ladle for autopsies? You use it to collect fluid collections, effusions, for a measuring jug. Someone with heart failure can get fluid buildup in their pleural cavities, around the lungs, for example. Sometimes several liters. There are the normal abnormal things like extra spleens, extra ureters, surprise tumors, and swallowed foreign bodies. The record holder was $6.25 in assorted change. The one that wins is the Sharpie in the bladder, with the cap on. I was the one that got to explain what sounding was to the resident and lab assistant. Sounding with a Sharpie. Yikes, that might be enough of this thread for me. Sounding with a Sharpie and then just going, oh well, when it slips all the way inside and never comes out. Wow, I've got a lot of stories for this one. We once had a homeless dude who OD'd on opiates. This comes in a lot. During the external exam, we removed his pants and they were just full of bacon. Like, at least 40 packs of bacon. Turns out he had shoplifted a ton of it, then shot up in some run-down house and died with it all in his pants. It was pretty shocking. We also had a guy who took a bullet to the back of his head. Execution style, and after the X-rays determined the bullet was not in his head anymore. We couldn't find the exit wound anywhere. Once we took out the brain, we discovered it exited perfectly out of one of his nostrils, leaving no trace of an external exit wound. 5 years ago an autopsy I viewed, the patient was put down to have died from post-surgical complications from a colostomy. Infection lead to sepsis and ended with MOF. When they began the examination and looked, they found some surgical tweezers left behind, which was attributed to being cause of the infection because of how tucked away they were. I am unaware of what happened afterwards, but it was definitely referred higher. As if I wasn't already afraid of surgery. This makes it so much worse. You would think that if you were suffering from such a terrible infection after a surgery, they would do everything possible, including take X-rays, to try and figure out how to help you, and also cover their own asses post-surgery. Incidental finding of a toothpick lodged in the small intestine. Wonder how much pain that person felt. My dad accidentally swallowed a toothpick that hadn't properly been removed from his food, and it poked a hole in the lining of his stomach. He had awful stomach pain for months. Doctors thought it was stomach cancer until they finally discovered it. Edit. We think that it was used in his food out to eat at a restaurant. Either broken in the food or not removed properly. And so he didn't know to be mindful of it. He does, contrary to popular belief, know how to chew his food. My new fear. This whole thread is fear-inducing for the smallest things that I would have never imagined can go into my body. Universe, you are crazy. My forensic medicine lectures took place in the department's Museum of Oddities. There are plenty of interesting items on display, but one particularly strange display caught my eye. It was an unlabeled cardboard box with 20-ish thin metal bars 10 centimeters, around 4 inches, long. One of the pathologists explained that the random pieces of metal were actually spoon handles which were found in a young woman's stomach. The remaining portion of the spoons was melted away by stomach acid. The woman was a patient in a psychiatric hospital in the 50s, 60s and evidently had a tendency to swallow spoons. But her unusual diet had nothing to do with her cause of death, can't exactly remember what it was. On a more humorous note, the museum also features a variety of strange tattoos. My favorite was a tattoo on the left upper thigh of a soldier which read, Nur für Damen. i.e., ladies only. I worked in a cadaver lab. People would donate their bodies to science. We would essentially cut them up into different cuts depending on what hospitals, med schools or researchers wanted. Most of the tissue went for surgical practice, i.e. a torso would be sent out for spinal surgery practice, a leg for knee replacement practice. Once we had a donor who died during surgery. We found a very large pair of scissors inside of him. We also had lots of donors with evidence of cancer, like tumors all over their lungs, with no medical history of cancer. We found a lot of abnormal or enlarged organs. We once removed a 50-pound liver from a guy, and also we found horseshoe kidneys, 2 kidneys fused together, in a person. Reading this only reinforces the idea that getting full body scans of some type should be an annual requirement. An 88-year-old grandma died of carbon monoxide poisoning. During the autopsy we couldn't open the back of the cranium. After much drilling we realized that her cranium was around 3 to 4 centimeters thick all the way around, leaving her with the smallest brain on a grown woman I've ever seen. She was fully functioning and never seemed affected by it in the slightest. I've never seen anything like it since. Just for clarification, I'm female with a background in forensics and profiling. Hope this helps. What is the average skull thickness? 5 millimeters. Less than a cm. So a 4 centimeters skull would be around 7 times thicker. That's fucking insane. Thanks for context. Grandma Juggernaut. Spoke with a pathologist at a conference. During her training at the medical examiner's office. They were doing an autopsy on a body that was found by a river. They did a CT and something looked funny about his gut. When they opened him up, his stomach moved. It was a snake that had burrowed inside his body. It struck and bit one of the techs before they realized what was going on. Thanks for watching.